This is Dr. Dennis Locks, Sports and Regenerative Medicine Specialist. I'm going to talk a little bit about avascular necrosis today. Avascular necrosis can occur to almost anyone, although it's extremely rare in the general population. And if you look at the most frequent cause, which is trauma, the other is idiopathic or unknown, it's really relatively rare in all sports injury, but it does occur. Some of the more famous incidences would have to be Bo Jackson. Bo Jackson was a legendary professional football and baseball player. He was great at both. He had an outstanding run in a playoff game, 30-yard run, tripped up, tackled, didn't get up right away, was helped off the field. It was the end of the season, and they didn't realize he had avascular necrosis. He showed up for spring training for the Kansas City Royals, and the team doctor saw him limping, got an x-ray, and found that his joint had been destructive. So the problem with avascular necrosis is that the necrotic area can actually collapse, leading to a rapid joint destruction, which is why you want to diagnose it and treat it aggressively with regenerative medicine or stem cell therapy or things that we can offer to try to prevent that. That wasn't around in Bo Jackson's day, and it had already progressed by the time we diagnosed it. Another interesting case is Brett Favre. Brett Favre was traded to the Green Bay Packers. The team physician noted he had avascular necrosis on his hip. His doctor didn't want to clear him, but the coach recognized the potential of Brett Favre, and Brett Favre played pretty well. He wasn't hampered like Bo Jackson with the limb. So the coach overrode him, and then history was made in that Brett Favre went on to have a great career. Some people that I have, we can treat, and they still have areas of necrosis, and they can continue to play tennis at a later age, do other sports. I have incredible results with teenage athletes. The ability of a teenager to improve is tremendous. I've had teenage athletes that actually the portion of avascular necrosis had completely resolved. But when you're 70 and you have an area of necrotic bone and you have arthritis, that's not the same as a teenager. So in them, we're trying to just prevent the arthritis from progressing and a rapid joint destruction. So we can use regenerative medicine, stem cell therapy for all of these different patients, whether it's a famous athlete, a high school player who's trying to get a college scholarship. If you can get a high school player and not get their joint replaced, which is being recommended, and get them a college scholarship, that's a wonderful thing, and we've done that. So diagnosing early, having an experienced physician is very important.